Hi there everybody, this is Dr. Priya Singh. I'm a cosmetic dentist. I have a clinic named Impressionz Dental Care which is in Mumbai for the past 10 years. Now there are lots of lectures and videos on how do we manage a medical emergency in our clinic. But today in this video, I'm going to talk to you all about how do we avoid a medical emergency altogether. In so many years of my practice, I have never faced a medical emergency because I take the necessary steps of precaution. I ask the right questions to my patient and I'm going to discuss the same with you all. So now, what is the first thing that you ask your patient? Do you have any medical history? If the patient says no, the first question that you have to ask is, have you got it checked? You'll be surprised to know that most of the people, they don't get it checked and they just take it for granted that they don't have any. So tell them to do the necessary test before you go for any major invasive treatment. Now second question would be, are you on any medications? Now suppose if the patient says no, then you ask them, are you supposed to take some medicine but you're not taking? Because most of the people, they think that they are fit. So even if they are supposed to take an antihypertensive or an anticonvulsant, they don't take it. So when you ask like that, you get the right answer. Check for allergies. Check for any past dental experience that they had which was not great. They fainted or they had some major gag reflex. If you ask all that, you are better prepared when you treat them. Now if they give you a history of some major illness or some medications that they are taking, or if they are pregnant, see that you receive a proper medical fitness consent from their medical practitioner. Also be very cautious of what you are prescribing the patient before the treatment, and if they are on some blood thinner, see that you get their INR or BTCT test done before you proceed with your treatment. Do the necessary precautions required. Now this is before the treatment. When you schedule a patient for a treatment, when you tell them to take the necessary antibiotics which is required or whatever medications is required, along with that, always instruct the patient that they are supposed to eat and come before the treatment. Maybe a small meal, but they are supposed to eat, because most of the medical treatment or if before the test, it is required that the patient be fasting or they have to be nil by mouth. So many times patient feels that even for dental treatment they are supposed to do like that. So please instruct that you have to eat and come, because you don't want them to faint or collapse on the chair. So that is very important. Now once you take the patient on the chair, see that you do a proper patch test for LA. It is ideally required. Apart from that, when you are filling the syringe for LA, see that you do it yourself and don't tell the assistant to fill it beforehand. You'll avoid two things. One, the patient has confidence that you're using disposable items on them, which is also important. And second, there'll be no confusion of the assistant filling something else instead of LA. So, because you can save a lot of problems if you do it yourself. That is very important. Also, keep the sodium hypochlorite and LA syringes separate. So if you're using 2 ml for one, see that you're using 5 ml for the other one. So even on your tray, you are not confusing the two. So that is very important. After that, see that you are checking for patient's body response. If the patient is over panicky, do not continue the treatment. Give him time to become okay. Sometimes just because the patient is over scared, there can be some medical emergency happening on the chair which you don't want. Now, if the treatment is for longer duration, many a times the patient can go into hypoglycemic state. To see that in your clinic, you keep a small meal kit. Okay, you can have a biscuit or a glucose packet ready for such situation. Or even if the situation doesn't arise after 1-2 hours of treatment, see that you give the patient a break and ask them if they would want to have a glass of glucose. That is very important. Now talking about patients who are elderly or a teenage or a young patient, see that they are always accompanied by a relative, so that in time of any distress you have somebody to help you. Now apart from that, see that you have a basic medicine kit in your clinic also for such situation, be it bronchodilator or antihistaminics or anti-angina or anticonvulsant, something like that. Keep a kit in your clinic if God forbid time comes, you can have it. Also have numbers of medical emergency places where you can send the patient immediately, so that you're not frantically searching when time is required. Apart from all that, after the treatment, see that you give the instructions properly to your treatment patient. But apart from that, see that you also give a printed copy of that or mail them the instructions, so that they can follow it properly and you don't have problems regarding the same. So I hope if you do all this, you will avoid most of the medical emergencies on your clinic, and the journey would be smoother. Stay tuned for more videos. Subscribe to my channel and also do like it. Take care.